Okay, could we please jump to slide 5, Jason? And we are going to start with roll call to verify if we have quorum, and then we will get started. Okay, this is the attendance roll call for the committee. We do need a majority of members or a quorum to officially hold this meeting. Committee members, after I call your name, please say present or here. If you are a designee for a member, please state the name of your committee member. And just note that you don't count towards quorum. Apologies if I mispronounce any names. Samaj White Algier. Songhai Armstead. Lauren Carden.
I'm here.
Um, Timothy Heaven.
Present.
Joseph James. Deshelle Kendrick. Kevin Klan. Graham Naus.
I'm here.
Great, thank you, Graham. James McKee. Alejandro Martinez. Christina Mills. I saw Christina in there.
I'm sorry, did you not hear me here?
Oh, nope. Perfect. Thank you. Lisa O'Connell.
Here.
Thank you. Carolina Reed.
Here.
Thank you. Jonathan Russell.
Here.
Thank you. Alex Sanchez. Alicia Sebastian.
Here.
Oh, thank you.
Alicia Sebastian is here. Thanks.
Thank you. Adrian Shilton. Carla Thomas.
Here.
Thank you. Alex Vitzotsky. And Javon Wilkes.
Present.
Thank you. All right, we do have quorum, so I will kick it back to Megan to start us off.
Great. Good afternoon, everybody. Thank you so much for joining us this afternoon. I'm Megan Marshall. I'm the Executive Director now of the California Interagency Council on Homelessness, and a few administrative updates in just a minute. But first, want to take a moment to welcome our newest advisory committee member, Jonathan Russell, who's joining us from Alameda County and replaces our former advisory committee member and co-chair, Roxanne Wilson, who was with Monterey County. So Jonathan brings the perspective of local systems working together every day at the intersection of housing, homelessness, health, human services, and also continuum of care. Which all of those things are incredibly valuable to this committee. So Jonathan, thank you for agreeing to serve, and we're very glad to have you here at the table and look forward to your contributions. Moving forward, so as most of you know, and as many of you contributed to the formation of a very significant addition to state government on July 1st, marked a very large transition for us to establish the new California Housing and Homelessness Agency. And under that, CalICH has transitioned from an interesting entity within state government, to a full-fledged department under that new agency of California Housing Homelessness Agency. So we have sunset the Business Consumer Services and Housing Agency, and are very excited for what's ahead. So for us, becoming a department, it's more than organizational change. It really strengthens our institutional footing while preserving the role that is at the heart of our work. Primarily being statewide coordination across the many departments and systems that touch homelessness. So, and it's particularly important at this point in time as we wind down the Newsom administration and look forward to what's ahead for California, but under considerable threat and hostility, unfortunately, from federal government. So, and we'll discuss a little bit more on that in a minute, but no single department, agency, or level of government owns homelessness in California. And so our role is to help connect those pieces, identify the gaps, improve alignment and accountability, all, with people and evidence-based practices at the center of that. So we're still working through practical pieces of standing up a new department. Appreciate everybody's patience, as you've probably gotten quite a few emails from my team and I with new email addresses and new Zoom links and all of those things. So appreciate your all support and patience while we work through some of the kinks in these early days. We are at this point officially 36 days old. So next on the list of updates, I just want to provide folks with just a short update on the federal Continuum of Care Notice of Funding opportunity and sort of where we are as a state and where our positions lie in terms of supporting our 44 continuums of care. So at the same time, we're very excited in California. The federal landscape continues, as I mentioned, to be something that requires a tremendous amount of our attention and alignment with states who are all participating yet again in a multi-state lawsuit. So HUD has, as I'm sure many of you know, have released the COC NOFO. It's due at the end of the month. Of course, folks, no surprise in terms of what changes were included there, and a lot of things that are of significant concern from years past. It's a complete departure from evidence-based practices such as Housing First. So we're also seeing continued federal action affecting California, one of California's largest COCs in Los Angeles. So the significant implications, not just for the region and the folks who have been permanently rehoused using those dollars, but LA is a significant portion of our state's not just homeless numbers, but our data and some of the most innovative and promising practices and solutions. So as goes the numbers in LA, usually goes the numbers of the state. And so we continue to support our city, county, and COC partners down there as they work through this challenging time. But just really want to underscore something that can get lost as federal policy changes. Housing First is and will remain to be the law in California. Our state requirements have not changed. California's funded programs are subject to our Housing First law and must continue to operate within those requirements. So Cal ICH, my team and myself included, are continue to make ourselves available to work one-on-one, offering deep technical assistance, thought partnership, whatever we need to do to provide clarity to our partners and our communities who are working through some of these confusing and challenging divergences from evidence-based practices. So we'll continue to monitor both the NOFO and developments affecting Los Angeles, but the state of California as well. And we'll keep you all informed as we better understand the implications. One of those series of emails that folks have received and will continue to receive from me are on significant updates, like concrete decisions that have been made in the space of the COC NOFO. So next up on the list is Months of Awareness. Folks notice I have a unique background for this meeting, the tagline being "Housing Stability is the most essential back-to-school supply." So we discussed at our last advisory committee, and the council adopted in the subsequent executive council meeting months of awareness. And for the month of August, the council has chosen to bring awareness to students in California. That includes K through 12, but also in our higher education system, who are experiencing homelessness or housing instability. So throughout the year, we'll continue to use these sorts of opportunities to elevate different populations, issues, and intersections related to homelessness. It's not, the intention is not to suggest that homelessness matters only in a particular month, or a population only matters in a particular month or on a particular day. It's just to create intentional opportunities to educate, highlight partnerships, elevate lived experience, and to connect the public to ways that we can collectively as a state better understand how to support our communities. So as I mentioned, we're beginning with back to school month, focusing on children, students, families experiencing homelessness and housing instability, and the very real challenges that can face folks face returning to school without housing security. So part of that effort, we're partnering with Mustard Seed School in Sacramento. We are a statewide organization with staff up and down the state. And we do roving sort of partnerships, but in this particular month, for this month of awareness, we're partnering with Mustard Seed School, which is at on our Loaves and Fishes campus in Sacramento, to help support families and children who are preparing to call Mustard Seed their home base school for a period of time. So small but tangible way to help connect our statewide communications work with what families are actually experiencing in communities. So we'll continue to lift up, and you all will hear a lot more about future opportunities for months of awareness as we sort of build the effort out, and always welcome ideas from you all. Also, we'll continue to tag you all and the organizations and the great work you all are responsible for and champion throughout the year to make sure that we're connecting it back to your individual work as well. So lots of moving parts as usual. We're building a new agency, a new department, navigating significant federal changes and challenges, continuing to defend and implement our evidence-based policy framework, continue to strengthen our partnerships, and looking for new ways to connect our work back to the public. So with that, we can move on to the agenda. Thanks, Claire.
Great. Thank you. All right. So just a reminder, this is a 2-hour meeting. We will do our best to keep to this time frame. There is a possibility that we may go over timing slightly. This meeting is subject to the Bagley-Keene Open Meetings Act and requires that it be open and accessible to members of the public. The agenda is posted 10 days in advance of each meeting, and quorum must be met to hold this meeting. Members may not meet in private to discuss committee matters of the meeting, and public comment will be available. Okay, so please to the agenda slide. Great, thank you. So we will do the call to order, tribal land acknowledgement, and we have already done roll call due to quorum. Then we will move on to the consent calendar, and then we will proceed to our main agenda items. So just a reminder, there will be an opportunity for general public comment near the end of this meeting. We will allow for a maximum of 3 minutes for each comment. We welcome all public comment and feedback. However, due to the structure of this public meeting we are in, we may not be able to respond to them. For this reason, if you have any specific questions you would like answered, we ask that you please email us at calich@calich.ca.gov. Okay, and with that, the advisory committee to the California Interagency Executive Council on Homelessness is hereby called to order on this day of August 5th, 2026 at 2:20 p.m. And I will move us on to our tribal land acknowledgement with Vivila.
Thank you. We wish to acknowledge that Sacramento is the unceded homeland of the Southern Maidu, Valley and Plains Miwok, the Nisinan people, the Patwin Winchun people, and members of the Wilton Rancheria tribe who have inhabited this landscape since time immemorial. We extend our gratitude to the ancestors of all California Native American tribes and their descendants, as we recognize that wherever we are joining from, we are all on California Native American land. Thank you.
Thank you, Vavila. So I will now move us on to the consent calendar. Next slide. So this is the consent calendar. The consent calendar is for regular or non-controversial items that need to be approved by the committee via a vote. We carried over the consent calendar items from the May 6th meeting. We have 4 summaries for this item for adoption, which are the meeting summaries for the August 6th, 2025, November 5th, 2025, February 4th, 2026, and May 6th, 2026 advisory committee meetings. Now, before I proceed, are there any comments from advisory committee members? Please raise your hand.
This is Graham. I don't have a comment, but I'm prepared to make a motion at the right moment.
Okay, great. I will, after public comment, I will ask for a motion. Thank you. All right. Before proceeding, since this is an action item that will result in a vote, we will now open it up for public comment. Please keep your comments to the item on the consent calendar only. If your comment is not related to the consent calendar, there will be time for public comment at the end of this meeting. If you are connected through Zoom, please select the raised hand icon in the meeting window on your computer. And for those joining by telephone, you may press *9 to indicate that you would like to comment. Once I call on you to speak, you'll be instructed to unmute yourself and you will have 2 minutes to make your comment. Are there any public comments on the consent calendar? Okay. Seeing no comments, Graham, I know you would like to motion to approve.
Yep. I'd like to make a motion to approve the consent calendar as presented.
Thank you. And do we have a second?
Second.
Great. Thank you, Javon. Okay. We have a motion to adopt. I will now call roll for a vote. As I call your name, please say aye or yes. You may also abstain or vote no. Samaj White Algier. Okay, I see Samaj is voting yes in the comments. Songai Armstead. Lauren Carden.
Yes.
Thank you. Timothy Heaven.
Aye.
Thank you. Joseph James. Dashelle Kendrick. Kevin Klon.
Yes.
Thank you. Graham Nouse.
Yes.
Thank you. James McKee. Alejandro Martinez. Christina Mills.
Aye.
Thank you. Lisa O'Connell.
Yes.
Thank you. Carolina Reed.
Yes.
Thank you. Jonathan Russell.
I'll abstain. Is any time.
Abstain. All right. Alex Sanchez.
Aye.
Thank you. Alicia Sebastian.
Yes.
Thank you. Adrian Shilton.
Yes.
Thank you. Carla Thomas.
Yes.
Thank you. Alex Vitsotsky. And Javon Wilkes.
Yes.
Thank you very much. So the motion passes, the meeting summaries are approved, and I will now turn it over to Megan Marshall for our main agenda item.
Excellent. Thank you so much, Claire. We will advance the slides. There we go. All right, everybody. So this is going to be the bulk of our time together today on this particular topic of older adult homelessness. Many of you recall we had an earlier discussion on youth homelessness in California and sort of the state's response in that space, and want to have a follow-up conversation sort of following in that same vein with regards to older adult homelessness. And apologies.
Oh, Megan,
We're at yeah.
your audio cut out.
Oh, sorry. Can folks still hear me? How about now? Nope.
We can hear you, Megan.
You can. Okay, great. All right. So apologies, folks. Just getting my notes together. Had a very eventful afternoon. We have a few very exciting guest speakers today, 3 of your fellow advisory committee members, but I just want to spend a little bit of time setting the stage for the conversation on older adult homelessness, sort of centered around in the spirit of our earlier conversations on youth homelessness, but just want to be thoughtful about what is distinct about this population. And really highlighting the important differences on how we approach individual populations experiencing homelessness in California. But want to start first with the fact that no one entity in California owns homelessness, including homelessness among special populations such as older adults. Unlike youth, where if they're foster youth, it's very, very clear in California state law who is responsible for that group of folks. Older adult populations, perhaps in adult protective services, if there is instances of abuse, neglect, etc. But as in general, homelessness is not clearly owned by any one group in California. It doesn't mean that communities are not serving special populations specifically. They absolutely are, including through state homelessness funding. But we generally have not created statewide older adult homelessness set-asides in the same way that we have for youth. And I just want to be, I think that distinction is important. I think it's important for us as state officials to acknowledge that on the front end of this conversation. So, but before we decide, that every population experiencing disproportionate vulnerability requires a dedicated set-aside or program, our first question for Cal-ICH's charge is, who's responsible for that population? What problem are we trying to solve? And which system is best positioned to solve it? So that's where coordination across our systems is needed. It's particularly important for older adults because their needs intersect with so many of our systems in housing, aging, healthcare, disability services, benefits, long-term care, hospital supports, etc. So today is really about helping us as you as an advisory committee, us as Cal-ICH staff, understand where that intersection exists and how the executive council, who again is our department directors and our cabinet secretaries, where we can all strengthen our individual approaches to strengthen the system. So it looks like we are on the next slide, so we can stay right here for a minute. But we have a very significant, I think, and fundamental definition challenge here. The first challenge is really defining who we mean when we say older adult. There's not a single age threshold across our systems. The state has not identified an age threshold to qualify somebody as an older adult. Homelessness research commonly begins looking at older adults around age 50 because we know homelessness is associated with acceleration in aging. But many of the systems we traditionally associate with aging don't begin recognizing someone based on age until much later. So that really creates what I think of as the 50 to 65 gap. So someone in their 50s may already be experiencing significant chronic illness, disability, mobility limitations, but they're too young for Medicare based solely on age, too young for age-based SSI, and too young even for early Social Security retirement. And it matters because definitions aren't, just academic. They determine who we count, who qualifies for assistance, and what interventions are available. So our homelessness research may tell us that someone's aging at 50, but the system's designed to support that population might not recognize that person for another 10 or 15 years. So I just want to highlight that as being the key takeaway here is even if an outreach worker is actively assisting what appears to be somebody who's advanced in age, they may not qualify for the safety net programs that are needed to support them through. So next slide, please. All right, so the second thing I think it's important for the group to understand is that the population experiencing homelessness itself is aging in California. So nearly half of single adults experiencing homelessness are now 50 or older. And within that population, we're really seeing two different trajectories. Some people have experienced homelessness for years and are simply aging while experiencing homelessness. But others have been housed for much of their lives and are experiencing homelessness for the first time later in life. And that distinction matters for prevention because the pathways and interventions look different depending upon that person's first experience of homelessness. So at the same time, homelessness and aging compound one another. Compared with older adults experiencing homelessness, older adults are more likely to have chronic health conditions, physical and functional disabilities, cognitive impairments, mobility limitations, and I don't think we talk about this as a system enough, but difficulties with activities of daily living. So, it's one thing to have somebody in a shelter, and it's another that person can, use the restroom and take a shower and tie their shoes independent of assistance. So those needs aren't static either. They can become more complex as the person continues to age. The underlying causes of homelessness are not necessarily, they're not fundamentally different across the various ages. Housing affordability and economic security are central. But what is different is an older person's ability to absorb the shock and recover from it. So a health crisis, a loss of a spouse, rent increase, loss of income are much harder to recover from when your income is fixed, your ability to work is declining or non-existent, and your health and your care needs increase. So that's really the key takeaway that we want to leave you all here with is older adult homelessness is driven by the same challenges across the overall experience of homelessness. But the older someone is in their experience of homelessness, their ability to bounce back, to recover is diminished. Next slide, please. All right, this will be it for me, and then I'll transition it to your fellow advisory committee members. But want to wrap this up with a distinction that I think is important for older adults. Prevention, diversion, intervention, these are different things. Prevention being, we're reaching somebody while they're still housed and keeping them housed. Diversion meaning someone facing immediate housing crisis, seeking shelter, and we identify a safe space or sustainable alternative before they enter into street homelessness. And intervention is what happens after homelessness has already occurred, when we're trying to help somebody exit the system and into permanent housing. So for older adults, the additional question that we as a system need to consider and to ask ourselves at every stage there is this solution sustainable? Is this something that can be sustained, or, is this going to be an ongoing compounding issue for this person? someone's on a fixed income and can't afford their property taxes is a big one. But we've seen things like new roofs, right? Like if somebody can't afford to maintain repairs, ongoing bills like a property tax bill, paying the bill or making that investment in the improvement might prevent homelessness today. But if nothing is done to increase their income and expenses are ongoing, they'll face the same problem in short order. So really have to distinguish between a temporary financial shock from a structural affordability gap, but from ongoing needs that are going to continue. So it means thinking creatively about interventions that are available. Shared or social housing, for example, might allow for people whose incomes aren't going to increase to pull their resources together and reduce housing and household costs. It's not something that's attractive for many folks. I think about if somebody told me I had to have a roommate today, I don't know that I'd be particularly happy about that, but it is the reality of our current housing situation. So in any case, the goal is not to keep somebody housed today. It is to find a solution that can remain viable as that person continues to age. So our North Star here and our key takeaway that I'll leave you with is the right intervention at the right time, but a solution that is sustainable over time. So what we're asking for you all to think of today as a committee as we transition to your colleagues on the committee is not whether or not Cal ICH should be responsible for holding all the things for older Californians who are at risk of or experiencing homelessness. We're not starting from the assumption that another population-specific set-aside is what's needed. Our role is coordination, policy development, and part of that responsibility is identifying where people are falling between systems, where existing authorities might not align with what we're seeing on the ground, where better data and policy alignment could be helpful, and where another system might actually be better positioned to lead. So, because if we wait till our older Californians lose housing, enter into homelessness, and that's when our work begins. We're intervening at the most expensive, complex point in the trajectory. And that last column on that table there, that compounding services, is an oversimplification, but it's meant to say, prevention will require usually the least amount of service, whether that's resources, financial resources, or human resources. As you go down that list, it requires more to resolve. So our speakers are going to help us look further upstream and from different perspectives through our state's aging networks, aging and disability advocacy, and the realities of housing and service delivery in rural communities. So as you all listen, I would encourage you to keep in mind, where could we as a state intervene earlier, who's the best position to act, and what would make that intervention sustainable. So with that, I will stop talking, turn it over to your fantastic partners on the advisory committee, starting first with Christina Mills.
Thank you, Megan. Hi, everyone. Great to see you. Christina Mills, Executive Director of the California Association of Area Agencies on Aging. We are the membership organization for the 33 area agencies in California, and I am the one and only staff of C4A up until next month. So we are small but mighty. Next slide, please. Before I get into the details of area agencies on aging, I just want to uplift that the administration created a master plan on aging over 5 years ago, and housing of all stages for all ages is a priority within what we call the 5 bold goals. So this is something that has definitely been a topic of conversation among the older adult aging communities for a number of years. And we continue to create recommendations and work towards policy changes, local service changes, and everything possible to support older adults in fulfilling their housing needs. In California, we see older adults as the fastest growing population of folks experiencing homelessness, which is very important because by the year 2030, we are expected to see more people over the age of 60 in California than under. I also just want to make sure that we're all rooted in the fact that aging and disability come with ageism and ableism. And we can't have this conversation without realizing that that is a big part of the challenge we face in all of the areas that older adults and people with disabilities seek services and support with. With that said, the area agencies on aging, I like to say, and many of my colleagues say, are unintentionally the best kept secret in the aging network. There are 33 local agencies across the state serving all 58 counties. And in California, we have a really unique model where some of them are county-run AAAs, and some of them are nonprofit AAAs. And then some of them have a combination of joint powers of authority. So there might be a couple of counties working together to provide AAA services. There might be a couple of counties working as a nonprofit to provide AAA services. And one of the things I think is really important and frankly why we don't often know or hear about the area agencies on aging is some of them provide direct services as a county or a nonprofit, and some of them subcontract out the majority or all of their services. So one of the services that are most often known is Meals on Wheels. The AAAs do fund nutrition services in a variety of ways, whether it be congregate meals or home delivered meals, and oftentimes Meals on Wheels is the service that folks know about. So just want to ground you in the fact that we are all over and yet very much not widely known as we would like to be. And we hope to change that over the next few years and over the next decade, especially as the population of older adults continue to grow. And I want to thank staff for inviting me here to present this topic today, but also thank our outgoing director from the Department of Aging for elevating this topic at the last council meeting, and for my colleagues at the California Commission on Aging for providing public comment on this very important topic. Older adults, again, is one of the populations we cannot continue to ignore when it comes to homelessness. And in addition to the nutrition services that AAAs provide, there is a variety of other services under the Older Americans Act that are provided. It may look a little different depending on where you are in the state, but information and assistance, transportation, caregiving support, which could range from respite to resources, healthcare promotion, HICAP counseling for Medicare, and care coordination. And while housing isn't a direct service under the Older Americans Act, it is something that is absolutely intertwined in the work that the area agencies on aging are doing across the state. Next slide, please. Thank you. So who do the AAA serve? And I want to really, give my appreciation to Megan for mentioning the gap between 50 and 65. I would really say it's 50 to 60. In California, older adults are usually 60 and over. We've seen that vary depending on the program most of the time. But I wrote down, actually, Megan, what you said. We do need a definition, and maybe that's a future piece of legislation. But for area agencies on aging, we are serving people 60 and over. However, we are also serving people under age 60, depending on services. So there might be folks with disabilities under the age of 60 that qualify for some of our services under our caregiving program. So I don't want you to think that it's completely limited. And of course, we don't turn people away for services, but we do provide services based on the greatest economic or social needs an individual has. And oftentimes they will call us, go through an intake process, and we will determine what they might immediately qualify for based on sort of a ranking system of their economic and social needs, and then move them forward for services based on that. Many of the programs in our state are also duly funded, not just by the federal government under the Older Americans Act, but also through Older Californians Act as well. Next slide. So the older adult housing challenges, Megan went through many of them, but one of the things I just want to share, if we were in person, you would see that I am a wheelchair user. I've been a wheelchair user all my life. And I cannot tell you, and I think I actually see this and observe it because of my lived experience. I cannot tell you how many times we get calls, and I have experienced this in many different environments, where older adults will say, if only I knew, if I was educated on the need to make my forever home accessible. So when you have the privilege of purchasing a home, but maybe you break a hip or you have a stroke and have physical limitations or whatever may happen as you age. Most often, as people age, they will acquire a disability. And thankfully, many of us with disabilities are aging longer than we have historically. And housing is really difficult to be able to not only obtain, but continue to keep in place when your house isn't accessible. So if there were something we could do to encourage developers to create visitable housing where it's universally designed with less steps, with more access into consideration, those would go a long way in helping people prevent homelessness, but also continue to be able to keep their housing. On the slide here, obviously, I don't think I need to read through it, but fixed incomes. And this is becoming harder and harder as the cost of living continues to increase. But Megan brought up a great example with taxes, not being able to afford your taxes. And, there's a lower number of people that now have the option of different government or retirement programs that are fully funded versus just being eligible for Social Security financial benefits. So fixed incomes for older adults is a big issue. And while it doesn't connect completely to housing, there is oftentimes a myth that Medicare, when somebody qualifies for Medicare, that they qualify for long-term services and supports. That is not true. And that means that people on Medicare who think that maybe they're going to have long-term services and supports to help stay in their home do not have that service. That is definitely a Medi-Cal service and something that we've been working towards in California and creating a middle-class benefit so that older adults and people with disabilities can have a long-term services and supports benefit that may help them continue to be housed. Of course, when older adults are hospitalized or institutionalized, they face the premature death experience, especially when they're homeless. It's a greater situation and greater social isolation following the loss of a spouse, a family giver, or support network. And we saw this a lot during COVID, especially when people were isolated more than ever, unable to go to maybe an adult day program or utilize their transportation services to get to a senior center for a congregate meal. Isolation among older adults is the fastest growing killer among the population. And then there's complex service needs that require coordination across healthcare, long-term services and supports, behavioral health, housing, and all the other social services. And I've already mentioned ageism and ableism and how that may come into effect in employment and housing and all different aspects of life. Next slide. So who is eligible for AAA services? I already talked about the 60 plus people, but also we're looking at people who are low income, folks that are representing minority populations, those with limited English proficiency, those in rural communities, which we'll talk about a little bit more, folks with disabilities. We know that lots of folks don't want to necessarily be defined as having a disability, so you may also see it referred to as functional limitations. Individuals 60 plus with Alzheimer's disease or related dementias, and then, of course, those at risk of institutionalization. Next slide. when we were deciding how to present this information to you all, I said it's going to be really hard to do an overview without going into the weeds of this. So I appreciate that we're having the discussion, but I do hope that we dive deeper into it in the future because there's a lot to it. Like every population, there's unique factors that need to be taken into consideration or in order to create robust policy recommendations to try to limit homelessness. So the housing insecurity and homelessness slide is really about all of the different ways that area agencies on aging are helping support older adults that are facing or at risk of homelessness. But I also want to share with you guys some of the programs specifically that some of our area agencies are doing related to housing. Some of them are incredibly amazing and some of them are very innovative. So in LA County, our LA County Area Agency on Aging specifically has brought in recently a housing and homelessness specialist to help navigate the APS program, Home Safe Resources, but also engaging with their disability partners through the ADRC network and supporting broader department strategies across departments to expand housing options for older adults. In Humboldt County, Megan alluded to people not necessarily being excited about home sharing, but in Humboldt and Del Norte, which has definitely got some rural parts of their community, they are operating a home share program that is an informal discussion and local organizations that bring people together that are experiencing homelessness and looking at potential utilization of home share models that exist or that they are creating as more homelessness comes through their door or that they are aware of. In San Bernardino, we have an incredibly robust program that also ties in mental health. The program there through the Pacific Villages Campus Project is a transformative housing initiative designed to provide stable housing with integrated wraparound services for individuals experiencing homelessness that also have mental health disabilities. The campus is collaborative and involves not only the Department of Aging locally and Adult Services, the Public Guardian, the Community Development and Housing, and other community partners to make it possible. And then in our area of the state, Yolo, Sutter, Yuba, Sierra, Nevada, Placer, Sacramento, they also operate a shared housing program called Key Connections. And we have brand new in LA City, our AAA just recently was awarded $14 million in rental assistance for older adults specifically. And last but not least, we have many of our AAAs across the state engaged in the APS. Through their APS program, they are involved in the home safe, home key program, depending on where they are in the county or in a nonprofit AAA. And I'd be happy to connect any of you with those specific programs if we want presentations on them in the future. Next slide. So recommendations. While C4A definitely has some recommendations, I also want to highlight that this slide includes recommendations by the California Commission on Aging. So early intervention, we've talked about that before. Being able to do some early intervention before homelessness becomes the crisis. Combining housing with supportive services that help older adults remain in stable housing. Building local partnerships and innovative housing solutions tailored to community needs. Expanding affordable and supportive housing specifically designed for older adults. Again, taking accessibility into consideration throughout all of these. Increasing operating subsidies so affordable housing remains financially viable. And expanding, very important, expanding the assisted living waiver and supportive housing options to help older adults avoid unnecessary institutionalization. Next slide. I know I'm behind on my time, so integrated housing with healthcare and long-term services and supports, I've mentioned that. Increase investments in homelessness prevention, specifically for the older adult population, recognizing that preventing homelessness is more effective and less costly than rehousing after a crisis. And strengthening cross-sector partnership among aging, housing, healthcare, and homelessness systems. And lastly, improve planning and coordination across state and local agencies to address the growing number of older adults experiencing homelessness. And again, I want to just remind everybody where I started. California has a master plan on aging. Housing of all ages and stages is something that we are prioritizing and wanting to continue to work with our partners across the state to make happen. Next slide. Thank you so much. And I'm sure that we'll be able to come back to questions. I know I went over time. Thanks, Megan.
No, thank you, Christina. That was fantastic. And I put in the chat for folks, if you are not familiar with your area for Agency on Aging in either the community you live in or the communities that you serve, would encourage you to visit CDA's website, find your local area for Agency on Aging, and think about how those partnerships can be more inclusive. So yeah, thank you, Christina. And we will move on to our next presenter, which I do believe is Lauren. Look at that. Great. Thank you, Lauren.
Hi, everyone. My name is Lauren Carden, and I'm the Director of California Housing Advocacy at Justice and Aging. Christina, I also had difficulty condensing the presentation, so I will try not to run over also. We can go to the next slide. Just really quickly, for folks who don't know, Justice and Aging is a national organization that uses the power of law to fight senior poverty by securing access to affordable healthcare, economic security, housing, and the courts for older adults with limited resources. Next slide. So our housing advocacy at the federal and California state level prevents and reduces housing insecurity and homelessness among low-income older adult renters. So our core priority areas include, they're listed here, protecting and expanding rental assistance and housing stability programs, protecting and strengthening tenant rights, and protecting and strengthening fair housing and civil rights. And we can assist other advocates through our trainings, educational resources, and technical assistance. We also engage in policy advocacy at the state and federal level, and we engage in systemic litigation to enforce the rights of low-income older adults. Okay, you can go to the next slide. Okay, so what are the unique challenges facing older adults experiencing housing insecurity or homelessness in California? I'm probably going to be reiterating and expanding on points Megan and Christina have already made. But the structural issues impacting all individuals experiencing homelessness can be compounded for older adults. So older adults face barriers like the lack of affordable housing, income insecurity, health conditions and disabilities, and years of compounded structural racism, all of which can lead to housing insecurity or homelessness. I'm going to talk through three main categories of challenges that older adults experiencing homelessness face in California. And then I'll highlight some promising solutions throughout the federal, state, and local levels. And I also want to thank the California Commission on Aging and Serving Seniors in San Diego for their collaboration. And we can go to the next slide. Okay, so affordability issues. So while affordability is an issue for all Californians, access to affordable housing can be particularly challenging for older renters. So first, renters face unaffordable rents as they age. The rate of older adults who rent their homes is increasing. And so renter issues really are more and more an aging issue. Many, I think as Christina mentioned, many older Californians live on fixed incomes that have been unable to keep up with rising rents, healthcare costs, and other basic needs. So many times, like, one catastrophic financial event can send an older renter into housing instability and even lead to homelessness. Many older renters are also extremely low income, so this puts them at a higher risk for housing instability. So roughly 6 out of 10 older renter households are cost burdened, meaning they spend over 30% of their income on rent. And then 4 out of 10 are severely cost burdened, meaning they pay over 50% of their income on rent. And we know that once housing is lost, it's nearly impossible for older adults to find new, comparable, affordable housing in their communities. The California statewide non-Medi-Cal home and community-based services gap analysis report which was released by the state, identified the lack of affordable housing as the largest gap for older adults accessing homelessness services. That report found there's simply not enough housing programs, such as the federal housing programs, that are available for older renters who need the assistance with paying their rent. And oftentimes the wait lists for like housing choice vouchers or affordable senior complexes are like years long. So these are really not an option for folks who are not already connected or involved with the programs. And then the UCSF statewide study on homelessness, they also found that most homeless older adults who were interviewed identified housing costs as a barrier to exiting homelessness. You can go to the next slide. So another challenge is accessibility issues. Older adults face barriers to homeless response services due to health challenges, social isolation, and limited access to technology and services. For accessibility, like we see this both in terms of the ease of navigating the homeless response system and also accessing the homeless response system for folks with health conditions, care needs, or disabilities. Older adults experiencing homelessness have a high prevalence of one or more disabilities or chronic health conditions. One study found that over 70% of unhoused older adults live with a disabling condition. Another study showed that the distribution of disabilities differs between older and younger people experiencing homelessness. So for people 18 to 44, the most common disability reported was mental health conditions, but physical disabilities and chronic health conditions were found to be the most common among adults age 45 and older. And any statistic I'm mentioning in this presentation, I have a slide that lists all the links to the resources and reports. So because of this disparity, older adults experiencing homelessness many times require more health and social assistive services to obtain and maintain both temporary and permanent housing. And the homeless response system really is not always set up to consider these needs. And one example is in interim housing settings and shelters. These locations are many times inaccessible to older adults who are living with care needs. For starters, the shelters are not equipped to meet like the functional needs of people with physical or cognitive disabilities. This is either because of like infrastructure accessibility issues, guest policy issues that restrict access for caregivers, or licensing issues that prevent the shelter itself from administering care. Also, the shelter system is not targeting older adults to ensure that the population is served equitably and ensure the shelter system is meeting the need. Even if all the shelter beds that are not currently reserved for youth or households with children were reserved for older adults, the shelter bed system would need to double in size to accommodate older adults who are experiencing homelessness. And HUD data showed that in California, none of the emergency shelter, transitional housing, safe haven beds, rapid rehousing, or permanent supportive housing units restricted their eligibility to older adults or people with disabilities. So again, no specific targeting for older adults. You can go to the next slide. Thank you. So the last challenge that I'll talk about is just with services and supports. So an additional barrier to housing stability for older adults experiencing homelessness is just the lack of funding for supportive services and the difficulty with coordination with the services and housing provider networks. So when we talk about care systems, we're mostly focusing on like personal care services, like home and community-based services. So anything from like in-home caregiving to assisted living facilities. And for many older adults, these care needs relate to assistance with activities of daily living. So this is like non-medical care needs. And housing providers generally do not provide these services themselves. Either the older adult has to hire the caregiver, which is the case for most counties in California for in-home supportive services or IHSS, or the support from the housing provider is provided through like a contracted entity. And sometimes these entities, they just act as kind of a referral hub for the individuals living in that unit. The gaps in the services and supports are mostly due to funding issues. That's what we've heard. Many housing providers just don't have enough funds to provide the robust supportive services for like the differing levels of care that you see in the population of older adults experiencing homelessness. There's also a disconnect between the systems of care and the homeless response system. So this just leads to older adults who are experiencing homelessness being placed in inappropriate settings for their level of care needs, and then kind of like cycling through the homeless response system without achieving housing stability. And like when thinking about the different levels of care, I'm kind of talking about older adults going from hospitals to recuperative care to needing personal care services based on their health needs, while also trying to navigate being eligible for shelter services or transitional housing or permanent supportive housing. So the two systems don't perfectly interact. Also for older adults, the care needed many times is ongoing support versus helping someone through an acute crisis. Permanent supportive housing is a great resource for the population of older adults with care needs. But again, funding for supportive services have not kept up with the need. And the permanent supportive housing system is not really set up to provide like the HCBS or the home and community-based services level of care. One example of this is just with IHSS generally. The individual receiving care needs to have a home address in order to get the care. For folks who are getting connected with PSH or permanent supportive housing, they have to get connected through coordinated entry, which is usually before they've secured housing. So they have to get the housing and then to set up the care afterwards, which just means there's a delay in stabilizing the individual in a housing setting. And sometimes this delay can be like many months or even longer to set up the IHSS care. We can go to the next slide. So these are just links to the reports, which I used to gather a lot of the information that kind of I quoted at you during this presentation. They're all really helpful resources that I hope people will consult. We can go to the next slide. So successes. So again, this is like a very quick overview, and like unfortunately not able to mention all the local successes because we are seeing a lot of successes at the local level. Like I think Christina's slide had mentioned, the most successful solutions have really been focused on prevention and keeping older adults housed. I'm just going to talk kind of some highlights at the federal, state, and local level. I mean, at the federal level, I just wanted to mention the federal housing programs like the Housing Choice Voucher Program, project-based rental assistance, and the HUD Section 202-811 housing. So really the most successful programs in making housing affordable for older renters. These programs generally require the participant to pay only 30% of the income on rent, and then if the income changes, the rent will change in kind. So these programs are really successful at keeping people housed and ensuring that the housing remains affordable. But obviously at this time, it's unlikely that we're going to see renewed investments or increased budgets for these existing programs, which is just why it's important that we're innovating at the state level and local level to cover the gaps at the federal level. For the state programs, I was also going to highlight the Master Plan for Aging that Christina mentioned during her presentation. So with the MPA, the governor kind of called for a plan to address and prepare for the aging population. So this was like a multi-departmental work and seen as a commitment to California's older adults and like a blueprint for how the state could plan for the demographic changes in the population. And as Christina said, housing was called out as one of the 5 goals of the MPA. So this work has been extremely innovative and just really shined a spotlight on older adults. But unfortunately, we have seen that in bad budget years. At the state level, older adults and people with disabilities are continually at the bottom of the priority list. And the programs supporting these populations are kind of always in threat. So our general urging is just as a state, we really need to recommit to the goals of the MPA, especially with the new administration, and focus our ongoing initiatives in the MPA on this issue of preventing older adult homelessness. One of the initiatives in the MPA that has been successful and is continuing to help older adults and people with disabilities is through the CDSS Housing and Homelessness Division housing programs. So these are particularly HomeSafe and HSTAP. They're both extremely effective programs that are specifically targeted to people with disabilities and older adults. And these programs have been shown through the data to prevent homelessness. However, the programs are not permanent at this time. HSTAP receives like a small ongoing appropriation, but HomeSafe does not. So coalitions of advocates have had to work each year to advocate for inclusion of funding for these programs in the budget. So again, we really need to invest in these proven programs and ensure that they are, ongoing, stable state homelessness prevention programs. I also want to quickly highlight at the state level, we could also invest more in strengthening tenant protections and protections against rent increases. The Tenant Protection Act of 2019 has provided many older renters with safeguards against exorbitant rent increases, and eviction protections and tenants' rights are really homelessness prevention tools, and we would encourage the state to support these initiatives. And then finally, at the local level, so as I mentioned earlier, affordability is one of the greatest barriers to housing stability for many older adults experiencing homelessness. And the UCSF statewide study found many older adults felt a shallow subsidy, a one-time lump sum payment, or a housing choice voucher could end their homelessness. We've had previous state legislative attempts to pass the pilot project for a shallow rent subsidy program for older adults and people with disabilities, but they have not been successful. But we are seeing success at the local level in shallow rent subsidy programs that are aimed at preventing older adult homelessness. And these shallow rent subsidy programs can be really effective to address those kind of unexpected financial events that can send older renters into housing instability and homelessness. So one example, in San Diego, they launched a shallow rent subsidy program for older adults. They provided like small subsidies of $500 to eligible individuals. And the organization serving seniors was really instrumental in getting this program up and running. And as a result of the pilot, 98% of the participants remained housed after support from the program, and 29% decreased their rent burden. So again, really promising results and an effective program. I think it would be great if the state could start collecting these kind of data and learnings from the local programs just to see how or if this can be scaled for statewide impact. And then one more highlight, I think. There's also been a push at the local level to integrate the supportive services in housing and to make supportive services easier for individuals to obtain. So in San Francisco County, they've developed what's called contract mode to assist with access to in-home supportive services, or IHSS. This allows counties to contract with like a home care agency that can provide personal care services rather than the burden being on the individual needing the care to find a provider and do the paperwork to set up the person to provide their care. And contract mode has been shown to help reduce wait times for individuals to get them connected to IHSS, which again, in turn can help increase housing stability and help people reach housing stability more quickly. I think I did that pretty fast. So there are many other local examples that I obviously didn't have time to cover today, but I'm also happy to provide more information to Cal ICH or of the local successes, because I think that's really where we're seeing a lot of these really innovative and successful programs. And then also just wanted to thank Cal ICH again for focusing the meeting on older adult homelessness.
Thank you, Lauren. Really appreciate that overview. We are going to move on to our final presenter in this conversation before we open it up for discussion to the broader committee members. But I just want to introduce briefly Alicia Sebastian, who's going to talk to us about older adult homelessness in rural California. Always worth reminding folks that just about half of our state is considered rural. And so looking forward to Alicia sharing more.
Thank you so much, Megan and other folks, for giving me the opportunity to talk about some of my favorite things and try really hard to condense this all. We can go ahead. As mentioned, Alicia Sebastian. I have the privilege of serving as the executive director for the California Coalition for Rural Housing. We're a statewide advocacy organization with offices in Sacramento, but we work from the Oregon border and tribal lands all the way down. Well, they're all tribal lands, but on reservation and trust land all the way down here to the San Diego, where I'm personally located. We can go to the next slide. Thanks. So CCRH advocates for a thriving California that grows affordable housing in rural, tribal, and farm worker families and communities. And this issue is near and dear to my heart. One, I love rural, all the things, obviously it's what I do, but I personally grew up outside the San Joaquin Valley and Yosemite National Park in very rural and remote Sierra Nevada communities. And the issues talked about here are the ones that my family has navigated all of our lives, but especially recently when my parents, as they've aged and with my father's passing in the past year or so, we have a lot of this that's really near and dear to my heart. So I'm going to go as fast as I can. I've been inspired by Christina and Lauren because if they can do it, I think I can. So let's see. So I think what we really want to think about in terms of like what we all know already versus like what's kind of specific or things we really want to say, like what's different about rural and why is there an entire 50-year-old organization dedicated to rural, tribal, and farm worker communities? Well, we know that there's always going to be cuts. And when it comes to the federal programs right now, even under this administration where we have often seen more different kinds of administrations preserve our programming and our resources for rural spaces, we're not seeing that now. It is not happening. California also is not recognized as exclusively or very rural place. And so oftentimes the things that are being addressed at a national level do not fit, of course, because we're so special, the realities of rural California. Obviously, the state programs have an inherent urban bias because the bulk of the folks who have come through, the research, the data, et cetera, is focused on urban spaces, our coastal spaces. And our programs really aren't designed to address the specific needs of agricultural communities, rural communities, and tribal communities. There are less local resources, there's limited state funding, like we said, there's non-existent infrastructure. So when we do finally have resources and we go to do the development in space, it takes a lot more just to do what normally there'd already be, for example, electric lines, maybe plumbing, maybe sewer, not just septics, not needing drainage sites, having actual lots that are already prepared. So these are all pieces that make it more complex and more expensive often to develop certain things, navigate development in rural communities overall for our affordable housing. And then there is resistance and some political will. A lot of this is seen in different ways, but they have in general a much lower tax base in rural spaces, and they have much lower tax base, which means there's a lot less political will to try to increase or drive that tax base and to redirect it towards affordable housing solutions. Next slide, please. So one of the places I like to start is like, what do we mean when we say rural? And California has over 14 different definitions for their state programs. And they're still not as inclusive. They don't get to everybody. But what we will say is that overall, the one that we define rural as is a combination of what USDA uses. Again, this is a federal approach to what is considered rural. And so it has a county level, right? The metro and non-metro counties. But California has a lot of metropolitan counties. Think of Fresno County with lots of smaller communities within it. And so that's where we need to start to do this other kind of piece of it. And that's where we get this health and safety code, which looks at a combination. It is at the census tract level, which means you need to have your actual site address to be able to confirm if it's going to qualify as rural in these spaces. There are separate ways to identify tribally designated housing entities as well. And again, not all of our agricultural and farm worker housing is in rural places, but we have obviously a much bigger role to play in housing California's incredible farm workers because of how much more agricultural work is happening in these rural spaces. And then we have these like rural in nature places, right? Where you're like, it looks and feels rural, but is it? And it's not in a lot of places. So a lot of the San Joaquin Valley, like Merced, Madera, those are not rural cities. The Central Coast does have rural places, but we're starting to look at a lot more of the far north, the Sierras. We're looking at the desert communities, Colonias along the border. And we have over 110, we have 110 federally recognized Californian tribes and even more unrecognized tribes. And so this really creates this very vast, very complex and scattered geographic community population, et cetera. And so what's different though about specifically like rural homelessness is, again, everyone's PIT counts are under, right? Our rates are definitely not as reflective of what we need. But within rural communities, because the homelessness is so less visible, because physically people are on levees, in fields, in the woods, they are physically not able to be seen. And therefore, when we do our point in time counts, it is much more likely that they will not be identified. Similarly, the other piece of this is like the visibility and the qualification and the definition and how we address and kind of name what is homelessness. In a lot of rural communities, especially in our much tighter knit intergenerational communities and our tribal communities and a lot of our farm worker communities, we are not seeing folks who are experiencing homelessness out on the street necessarily. There's the overcrowding. They're sleeping on couches. They're sleeping in someone's broken down car on their property. So again, sometimes the type of solutions that the community finds, such as couch surfing, renders folks as not technically homeless under certain program requirements. And so that's a place where a lot of rural Californians find themselves kind of navigating, do we qualify for these resources? COCs don't exist in vast swaths of our state, but we don't have technically a balance of state. And a lot of the COCs are much broader and include these urban places and that are not as inclusive of our rural spaces. And when we get into like COCs and whatnot, a lot of the time, folks like our tribal community leaders are seen as kind of like optional seats at the table as opposed to required components of what every COC should include. And so when it comes to trying to address homelessness for older adults in tribal communities, the COC presents additional structural challenges. A lot of our urban centers are where the services are. So we hear about people being put on buses and shipped over places, but in a lot of places, they do not have services at their local level. And they really do need to figure out a way to get people experiencing homelessness in their own communities to another urban place where those services are. And we don't have a lot of infrastructure like public transportation. So what does it mean if you're experiencing homelessness in my hometown of Mariposa and the services you need are actually it's gotten a lot better, but based in like Modesto, that's several hours away and there's no public transportation necessarily. Next, also scalability. I think that's another piece, but we can get into some solutions. Also, though, new data, thanks to all of our partners and folks, is showing that rural communities actually have higher per capita rates of homelessness and a higher growth, an increase in that in that rate of growth than our more urban counterparts. Am I still good? I got timers. Okay, great. Next slide then. I talk really fast already, y'all. So what's the deal with the older adults part, right? So in older adults, we have disproportionately more older adults in rural places. And in general, we have a lot bigger challenges dealing with aging in community because of that lack of resources, because of the remote nature or the infrastructure. For example, my father had an issue. We needed to get an ambulance in to take him to urgent care. There's no urgent care emergency centers that were open in Oakhurst, which is like the other side. And so, he had to go down to Fresno, which is over an hour away. But the ambulance could not cross the bridge because it is not maintained by the county. It is maintained by the personal folks who happen to live in that area. And it is not a great bridge. And the pathway below it was filled with snow. And therefore, my mother, who is 70-something, put my 80-something-year-old father, who's having an emergency, into a vehicle and drove to meet the ambulance. So this is a really good example of like the physical challenges geographically based within this. Also that proximity services we talked about. But a big piece is that we also have folks who want to age in community because rural communities are much more than just their neighborhood. when we are talking about small communities like mine in Mariposa that has no stop signs in the entire, stoplights in the entire county, you literally are driving down a highway, you will wave to everyone you see going by because they are all a part of your community. And so when we talk about aging in place, we're really talking about aging in community, and our community is really big compared to a neighborhood. We have a lot of older homeowners, and as things like insurance rates go up because of fire risk, this is something my family had to deal with. Homeowners are having to understand and decide whether they can afford to stay in the homes that they own. And this is causing a lot for other homeowners, renters, etc. Also, we have a lot of older housing stock. And housing stock, the very limited affordable housing that already exists in a lot of rural communities, has mortgages that are maturing. So we're about to lose a lot of our affordable housing stock in these rural and agricultural communities. And the quality of the housing, and this is separate, like we could have a whole other, like, I don't know, hours and hours talking about the quality of housing currently available to many of our tribal members. And so given that how bad the housing stock is there and the few resources available to rehabilitate, older adults living in rural communities already have less stable housing. And there are many folks who do not have access to things like running water, heat, air, gas. We have a lot of older adults who are really restricted to living in one room of their home. All right, we're going to do this. I have to bring it on home, guys. I have like 30 seconds. I got this going. So next slide, please. So when you add this all up, what we're starting to see is that it's very different approaches and solutions, and some of them are the same no matter where you are. So when we start to look at solutions for older adults, homelessness in these spaces, when it comes to farm workers, we're really looking and advocating as an organization with our membership, and invite you to join us for more inclusive definitions of what a retired farm worker actually means, because a lot of folks who qualify as ag workers and have access to housing when they are at retirement age and they are no longer working, they lose their eligibility for the units they've been living in. And that is with nonprofit and public affordable housing. Because again, we talk about these like urban biases. This is what happens when folks who don't necessarily understand some of these realities put together a program. And maybe it's not necessarily a program designed for older adults, but we have competitive programs that we have to apply for. And what has happened is that a lot of the programs are not going to be feasible for older adults. So the state isn't saying we're not providing this resource, we're not putting they're saying, well, if you have a senior project, you can apply. If you have a farm worker project, you can apply. You can do these things, but you're not going to be competitive. And therefore, you're not going to actually get the dollars that are due. This happens a lot with our tribal communities, even more so. And that was why there's been a huge shift to create an actual state affordable housing grant program exclusively by tribes and for tribes, and that tribes can determine the best way to structure that program to meet the specific needs of those communities. And then we have a lot of rural communities. This is really about services. We don't necessarily need 150 units of permanent supportive housing necessarily all the time, but we might need 40, and they need to be really mixed because it might also need to include family units. So how do we incentivize or provide support for things to pencil at that smaller scale? And one example is Home ARP through the CARES Act had some approaches to help rural permanent supportive housing folks apply and have incentive to have smaller projects and need less of the subsidy overall because they were able to, they didn't need 150 units. They only needed to fund a few of those units. I could talk forever. They're all listed here. We are literally moving all of these things. You're all here with us, moving all of them. You're all in our places. So my last one is, I think it's not my last slide. It should just be my contact information. But shameless plug, our Rural Housing Summit is happening this October. You can still register, but that is a place where many of you all already join us, where we dive in for very deeply as practitioners for 3 days. There are no panel presentations and slideshows. We all get in a room together and we say, hey, what's going on? How do we solve for it? And then that's how my organization actually gets its policy platform for the next year. So any of the solutions you've seen, any of the successes you've heard me talk about, those all came from partners like you working with us in real time to help identify and move that. So that Tribal Housing Grant Program, the Farm Worker Housing Program in general, all of that came from our partnerships with all of you in those spaces. All right, I went over a little, but I tried. I don't know if I could do it like Christina and Lauren. You guys did it without making it look like you were trying really fast, but I obviously did. Thank you all.
No, that was excellent. Thank you so much, Alicia, but thank you to the three committee members who presented today. We're going to open it up for discussion. We have some questions on the next slide for inspiration. We had 4, but given time and wanting it to be, hearing from the committee itself as opposed to focusing on a number of questions, we wanted to open up for discussion. But really wanting to start first and foremost with what should this advisory committee elevate to the executive council for consideration within its role in statewide policy coordination, data, cross-system alignment, with particular emphasis on the fact that it's our next executive council meeting is on September 2nd, with this as the primary agenda item as well. So folks remember the youth conversation was focused on what are departments doing, what are departments investing, and then we were fortunate enough to have some system partners also present to the council, persons with lived experience, but wanting to hear from this group on what should be sort of the framework for the executive council to use in its time for September 2nd. So I'll open it up to the group.
This is Christina. I think that all 3 of us as presenters brought up some really great recommendations that could be used, and maybe putting those into a collective list to share with the council would be helpful. But I think they were an incredible list of recommendations.
Yeah, and we're always happy to lift those up, particularly from the advisory committee, from our lived experience advisory board, keeping in mind the council doesn't have purview in all of the areas. Like if for example, we could be responsible for allocating all of the dollars that relate to housing and homelessness, that'd be great. But within its purview, there's certain limitations. But the intention is to definitely give them an overview of what was presented today. Like here's a thorough readout of what we heard from our advisory committee, and here are the things the advisory committee would like to impart upon the executive council. And it will not be me making and sharing that message. It'll be Alex, who of course is the co-chair for the advisory committee. He's not with us today. He's going to watch the whole thing. Hi, Alex. Happy that you're watching the recording. But yes, he'll be sharing a summary of that. I see Tim's hand first, and then we'll go to Javon.
Hi. So one of the things that the overarching things I saw in the presentations was the need for like rental subsidies, and so if there's any way we could really suggest that, or push for any kind of work that goes into creating like some sort of permanent rental subsidy program, I think that would be a good recommendation.
Thank you, Tim. Javon. I'm so curious what our youth, our historic youth advocate has to say about older adult homelessness, but appreciate your participation.
Thank you, Megan, for the leadership, and thank you, presenters. Yes, from the youth field, but when I saw because I look at a lot of the data, and when I saw the data for the older population, it definitely broke my heart. Real hard, because yeah, it's just as young, life be life, but it's real for our adult population, especially if they've never experienced homelessness in their life in their first time. And that's not discounting the fact that they may need health services support. But anywho, this goes into the youth side too. But when we're having this conversation, the data on rental assistance under DHCS, how many adults between, I think that, 50 and 56, to understand who's gaining access to that funding under CalAIM, but then also that other part, and I'm not sure if I'm correct on this, but there's supposed to be someone said it, I think it may have been Christina, about care after being hospitalized. DHCS and managed care plans are supposed to be delivering that services. And granted, I'm not in the adult space, but I did hear that it's not going according to the promises, and so would like to know how managed care plans are stepping up in that, and then also as it pertains to Prop 1, the old one, the behavioral health one, what is happening in that space for the older population, and those just questions really around the data so that that is clear for state and for the local electeds.
Yeah, thank you for that, Javon. And so I think it's definitely something that I have not considered, but really important to have the conversation of, we know what the data tells us in terms of who's experiencing homelessness. We know it's an older adult population, it's our fastest growing population. Who is accessing your services? Is there a balance there of, is there representation of the population who's disproportionately experiencing homelessness? Are they getting access into those systems of care and connecting with the right organizations? So I appreciate you lifting that up, Javon. Adrian?
Javon inspired me to speak up. Adrian Shelton with the California Alliance. Just kind of wanted to echo what Javon said, because we represent nonprofit providers that are working with children and youth, and we work, more significantly on the youth prevention of homelessness side of things. But this data is very compelling. I've heard, many presentations over the years from colleagues, and I just want to encourage us to think big about what we might do or support in this space. Including set-asides. We're working with the bill on a bill this year with Javon to establish our state's first Office of Youth Homelessness Prevention. Like, we should do something similar. Kids have families, kids grow up. Like, this shouldn't be a zero-sum game. And so we would be in to also support those efforts as well. So just thinking, like, just because we're sort of on the youth side of things in terms of our advocacy more significantly would not preclude us from wanting to support these efforts. So I'm really appreciative of the data and presentations today from my colleagues. Just really respect the work and encourage us to think about what else we can do in this space together.
Thank you, Adrian. Carolina?
I just want to thank the presenters too. I felt like all the presentations really tried to highlight a lot of misperceptions that are out there, probably by both the public and policymakers, about what the problems are, what the definitions are. I think we have to think carefully about integration with the health systems, because for older adults, it is also a health issue. I think CalAIM needs to be part of that conversation, but I think that there needs to be sort of a broader effort to integrate housing and health for different populations at the state level. I think that there's a real opportunity there. I think the other thing I was thinking about is that we also have a lot of old people who have been living in affordable housing, who are aging and who can no longer stay in those same places. And I think we haven't confronted the challenges of the overall aging population, even in affordable housing settings. And then I think maybe my last point is, I just lost my last point. I'll come back to it. I lost it. It'll come back.
Yeah, thank you, Carolina. I think the needs of older adults, wherever they may be aging, but the constraints that exist. There you go. Okay. Yep, go ahead.
Yeah, so I think it is so hard to navigate these systems, even when you are completely abled. And so I just got a sense that the fragmentation across all of these different programs has got to be so hard if you are the person who is at risk of homelessness and or who needs certain health support. So if there's anything that you all can do to sort of integrate pathways that people can follow to get support, I think that that could be really valuable.
Yeah, no, I appreciate that. Thinking about, if my first experience of homelessness was as an older adult who is already perhaps on the fringe of technology, maybe I'm isolated, all of those things are already overwhelming. But then to think about this being my first time to have to navigate being outside is, it's overwhelming. Jonathan, I see your hand, and then we'll go to Christina.
Yeah, just also processing and appreciating just the diversity of the presentations raised. Obviously, speaking from a very much kind of paradigmatic urban context behind me here in Alameda County. It was really appreciating, Alicia, just hearing about the unique, like the differences in the rural context. And I think the piece that jumps out to me, thinking sort of self-critically as a local continuum of care and county representative around things like coordinated entry and the rental assistance programming we do have, right? Much of which has been sort of formed conceptually and practically around the acronyms and types of rental assistance programs we get through the continuum of care through federal programs. So we have things like rapid rehousing, we have things like permanent supportive housing. It really jumps out to me listening to these presentations that in many ways, as you shared, Megan, at the beginning, these kind of two types that are quite different, though over time might connect of older adult homelessness, which is to say economic shock over 50, potentially not a lot of the complex behavioral or physical health needs to begin with, but like they are pushed in because they're on a fixed income. Our system does not prioritize their needs, right? For things like permanent supportive housing, nor should it, right? Because that is intended to have the attendant conditions. And so we miss out the opportunity while folks might very quickly languish, to be candid outside and then develop the needs that would sort of prioritize them for permanent supportive housing. Simultaneously, time-limited rental assistance programs like rapid rehousing would also not meet the need because they have more of an enduring need because there's not the income increasing pathway. Simultaneously, on the other end, often older adults, let's say when those needs do increase, that would prioritize for things like permanent supportive housing, like behavioral health or other disabling conditions. There are often other attendant conditions, physical healthcare conditions that make regular permanent supportive housing not suitable as well, because there are, as was raised really well, the healthcare needs that are just not conceived of or usually included in PSH. So I think it's just so important to point out that it pushes against both ends of our system. Not appropriate because we don't have sufficient lighter touch, but like enduring rental assistance resources, and also the need for more than permanent supportive housing or permanent supportive housing plus these additional healthcare resources embedded. So to Timothy's point, the potential for flexible state-based rental assistance programs that fill some of those gaps and can support and bridge people, I think is really necessary because we've got to get outside of the acronyms if we're going to serve these distinct populations that sort of exceed traditional PSH and sort of precede what that currently prioritizes. And the last thing I'll say is I think there's just a lot of good evidence for presumptive eligibility and like expedited SSI programming in communities has shown to save money, around your GA. And so ways that we can really drive those federal, the access to the federal benefits in conjunction with things like rental assistance, I think could really prove like successful paired programming to kind of get us out of what the homelessness system, frankly, is not structured to serve well right now.
Yeah, thank you, Jonathan. And we'll go to Christina, but I also want to highlight like how how folks are interacting or how they can interact with coordinated entry or with our continuums of care. It's very modern. It's much different than what it was when I started in this career, 20 years ago. And so, having to have a cell phone, having to be able to connect to a website, with maybe the smallest font in the world, all of those things, also presenting unique challenges to this population, and others as well. But also want to think, and this is more of a reminder for myself, but Jonathan and I have had separate conversations about where can CalICH be helpful in sort of stepping into spaces where We know we have partners on the other end who would want to engage, but who are counties, our cities, our COCs, our tribes also, who are not able to do that relationship development. And thinking about faith-based communities being one in particular, particularly with older adult population. I think of, food pantries and community feedings and those sorts of things. And oftentimes it's an older adult population who is just on the brink, who are accessing those services. And so that is something that CalISH is digesting and thinking collectively with our partnerships here. How can we step into that space to make those relationships meaningful? Christina?
Yeah, I appreciate that, Megan. And you kind of just touched on what I wanted to bring up, which is, in my mind, an elephant in the room that we probably need to talk about a little bit more, which is digital literacy and the digital literacy challenges among the older adult community, and whether that be the digital divide itself or just being able to navigate a website or use an app on your phone. And for somebody like me who is a caregiver for my 89-year-old grandmother, I've tried and tried and tried and tried and tried until I'm blue in the face to teach her how to use those kind of platforms. And it's become really, really frustrating and difficult, to be very honest. But then I also have a 65 and 70-year-old aunt and uncle who live with me who also face the same challenges, that didn't have to use those types of communication devices when they were in the workforce. And so taking digital accessibility into consideration and digital literacy. But when we talk about access, we also need to think about digital access. And a lot of times, I know in the disability community, we talk about it being accessible to people who are visually impaired or people who might need captioning or other things when we're online. But when we're talking about older adults, digital literacy and digital access can look very different. And so if we could also advocate through all of our organizations and through our partnerships to remind people that digital literacy has almost become an activity of daily living challenge for older adults. And I have definitely considered whether or not we should push that as an activity of daily living issue that needs to be prioritized, because it's become such a battle. Every time we become more digital, we lose more people, it feels like.
No, that's an excellent point, Christina. Thinking about, I don't know that we need like a bill to define activities of daily living. It is just, what do most people have to do to exist in the world on a daily basis? And like, where are folks falling through the gaps because they cannot perform that on their own without assistance? And so, like a little light bulb off in my head, thinking of digital accessibility and engagement as an ADL. Yeah, thank you. Tim?
Yeah, just listening to everyone's input, I appreciate it. And also, thanks again for the presentations. Very, very good presentations. I think I work with the older population, and one of the most difficult and challenging in an urban area, but one of the most difficult things is like I still have a struggle with like finding like resources for them. Like where do I send them to? So if we could create some sort of streamlined, I'm saying at the state level, maybe streamlined like guide or method where like a one-stop shop where everything's together, all the saying everything's updated, require organizations to update their things on this site or whatnot, just someplace where it's easily accessible for them. It would make things a whole lot easier, or even for service providers to be able to go to, maybe it's not where they can access, but where service providers can access. I had another thought, also to create like this homeless identification card. And that might be another idea for the state level, where it have like a QR code on it, and maybe if they can't access QR code, someone else could help them, and they could update their locations if they're homeless and they're moving to different locations. They could update their locations that have the connection for their case manager on there, stuff like that. There's a lot of different things you could do with the homeless ID card, you know what I'm saying? But it'd be maybe have like some of their homeless rights on there as well, and it helped also like with law enforcement interactions to say that, look, I'm signed up for services. I'm just waiting. I'm just waiting for my services. I'm signed up. So I think there's a lot of things you could do there with that too.
Yeah, we are always thinking about how to message like the existing structure, the roles and responsibilities. It's one of my least favorite things in this position for Cal ICH to receive a message from an individual actively experiencing homelessness, reaching out to us for support and services, because we're not a direct service provider. And so how is the state positioning itself, communicating outward, to folks so it's clear, or at least more clear, who is responsible for what and where folks can go within their community for those sorts of assistances. But so really looking forward to the conversation with our council. Staff definitely are taking notes of all of these recommendations. We will absolutely incorporate a readout of what the recommendations have been in the presentations, but also in this discussion to sort of help set the foundation for what the discussion can be and should be for the council meeting. Would definitely encourage you all, because you love this 2-hour meeting, I'm sure you'd love a 3-hour meeting. So would encourage you all to listen in on our council meeting on the 2nd, where we'll continue this discussion. If there are any motions in that meeting for actions, directing staff to do additional work or, develop more thoughts around this, we will absolutely message that back to this body, keep you all in the loop if you're not able to join that meeting. We touched on messaging, but that really has been, I would say, as somebody who's served in local government for almost the entirety of their career, absent these last 3 years here at the state, it's messaging where I feel the state has the most impact and can be the most impactful and supportive of our community partners. So appreciate you all spending some time on that question as well. But with that, I will turn it over to Claire. I know we have some hands in public comment, but before we do that, any final thoughts or any final concerns, considerations from the advisory committee? Great. Shout out again to our youth advocates and experts for participating. That brings a smile to my face to see folks interested beyond what their scopes are professionally. So appreciate that. Claire, I'll turn it over to you to facilitate public comment.
Great. Thank you. Thank you for such a wonderful meeting today. We will now accept general public comments. We welcome all comments and feedbacks. Due to the structure of this public meeting, we may not be able to respond to any questions. So if you have any questions for Cal ICH or the committee, please email us at calich@calich.ca.gov. A Cal ICH staff member will soon share their screen with a 3-minute countdown timer, and we will warn you when your time has expired. If you are connected through Zoom, please select the raised hand icon in the meeting window on your computer. And for those joining by telephone, you may press *9 to indicate that you would like to comment. Once I call on you to speak, you'll be instructed to press *6 to unmute yourself. And I know we have some hands raised, so I'll just wait for my timer to come up. Well, I'll get us rolling, and then, oh, Jason, are you?
Oh, sorry, I may not have been sharing the full screen. Sorry about that.
No worries.
How about now?
Perfect. Thank you, Jason. Okay, first in line, we have Ruby. Please go ahead and introduce yourself, and you have 3 minutes.
Hi, I'm sorry, if you guys could confirm that you guys can hear me.
Yes, we can hear you.
Okay, thank you very much for having me. My name is Ruby Toralbo-Pio. I'm a member of KTHA, Kings Tulare Homelessness Alliance. And I'm asking this advisory committee to please stop looking at homelessness as an isolated housing issue. You know, I know that this is was more of a presentation for aging. I'm 33 years old. My disability involves it's like I'm 80 in the inside. My body, I'm deteriorating faster than what I should. I'm losing micro movements. Sometimes I stutter. One of the times I fell and I hit the side of my head. It gave me a aphasia, which it's been tough to lose a part of me, my young part of me, you know, and to be able to function. And now that I'm facing homelessness, you know, I think that I want to share this is why I want to share this information, because it's not being old in the inside, you know, you understand, you know, aging folks that are trying their best to be able to connect with themselves and be able to focus on housing and talking to landlords or talking to whoever it is, welfare department, you know, different agencies, lawyers, even if it comes to that. The bottleneck isn't just housing. For me, I believe it's a complete breakdown of accountability across systems. I'm originally from the Bay Area. I've lived in Kings County for 3 years, and what I witnessed in rural justice is justice gap. The California Coalition of Rural Housing understands that rural California has unique barriers than other, but rural communities need more than policy papers and technical assistance. Families need actual legal representation. In Kings County, finding an attorney willing to litigate against local governments here and agencies is extraordinarily difficult. Nobody, not even Morgan and Morgan, you know, that represent everywhere, want to represent us in Kings County. That access to justice gap should be part of every conversation about rural homelessness. Disability Rights of California has helped countless of Californians, but only with legal information. Despite their, I did request their grants from State Bar, their paperwork and stuff, and it says that they represent, they can to receive those grants, they have to be able to represent and provide representation to these communities, you know. If I can have an extra 30 seconds, I just need to take a breath real quick. I just need to adjust my body. Sorry, is that okay?
Of course, you can take another 30 seconds.
Okay. Okay, thank you. Carol, I just wish that DRC, you know, can be able to stand by their word, you know, to represent us. You know, I had a case with DRC, and I was just receiving counsel. I was promised different things, you know, and unfortunately it didn't go good. I just don't understand why, for example, they say they can. If we had them on board, you know, to be able to help California, they have a vast data of information, you know, that in different ways that they can help, and their word, you know, is their jurisdiction goes beyond, you know, what California state lawyers can do. You know, they're federal. They're able to
Ruby,
help
I'm
way
really
more.
sorry. If
That's
you
okay.
if you would like to continue, you can email us at calich@calich.ca.gov. And then if you're happy to write your full comment there, that'd be great.
Thank you very much for having me.
Thank you, Ruby. Okay, we will reset the timer, and up next we have leadership. If you wouldn't mind introducing yourself, and you have 3 minutes.
Good afternoon. My name is Robert. I'm a father. Reached out to California Coalition for Rural Housing. I completed our family's housing situation and asked for guidance, and nobody ever contacted me. That That isn't simply the disappointing. It illustrates a larger problem. California has organizations advocating for rural housing, yet families in rural counties are still falling through the cracks. When people ask, homelessness continues. Part of the answer is that families are often left without follow-up after asking for help. As a father, my greatest concern isn't only housing, it's what happens after a family becomes homeless. Across counties like Kings County, families living in motels or temporary housing become vulnerable to losing custody of children. Housing instability begins to be treated as though it reflects parental fitness. Even when there is no abuse or neglect, children belong with safe families, not in government systems simply because their parents are poor. I respectfully ask this advisory committee to recommend stronger statewide accountability for agencies receiving public funds. If organizations accept referrals or public resources, there should be a measurable follow-up standards, response timelines, and transparent reporting. Families shouldn't disappear into voicemail or in paperwork while waiting for someone to return the call. Thank you.
Thank you. You did cut out a little bit, but I think we were able to hear most of what you said in the end. Okay. Okay. Alana, you are next. You have 3 minutes. Please introduce yourself.
Hello, can you hear me?
Yes, we can hear you.
Perfect. My name is Alana Martinson, and I'm speaking on behalf of Serving Seniors, a San Diego-based nonprofit that serves low-income older adults through an innovative whole-person wraparound model of care, including meals, housing, health and social services, and activities. As it has been stated with some of our presentations, older adults are the fastest-growing group becoming unhoused. As we've said, fixed incomes from either Social Security or SSI are just not keeping up with the cost of living. But what we have found is that modest rental assistance as low as $300 a month can help keep seniors housed, off of the streets, and out of hospitals. By comparison, the annual public cost of homelessness is around $40,000 per person. Serving Seniors now operates 8 shallow rental subsidy programs throughout San Diego County. These have been funded through public and private investments. And across these programs, we have seen housing stability success rates ranging from 96 to 100%. Preventing homelessness among older adults is not only more humane, but also far more cost-effective than responding after a housing crisis has occurred. Thank you so much for your time.
Thank you very much. Okay. Marika, you are next. Please introduce yourself, and the timer will be restarted.
There we go. Good afternoon. Hi, this is Marika Melman with the California Commission on Aging. I want to thank Cal ICH and this advisory committee for focusing on older adults today. Megan, Christina, Lauren, Alicia, thank you for your excellent presentations. It was just wonderful to hear all these different perspectives. I wanted just to call out the role of chronic health conditions, behavioral health, and substance use issues in the successful rehousing of older adults. Aging and the stress of being unhoused compounds existing health and behavioral health issues. And if an individual doesn't bring health or behavioral health issues into homelessness, they certainly develop them through that experience. So successful rehousing of older adults requires some level of health care integration, either in permanent supportive housing, if not actual acute care supportive housing. I would ask that the advisory committee advance to the full council the success of established California state programs and the necessity of continued funding for these, such as they've mostly been called out already, Home Safe, HSTAP, CCE and CCE preservation, as well as monitoring Prop 1, the Behavioral Health Services Act, to ensure that older adults are not left out. I would also love to see, or we would love to see, funding for housing navigation at the AAAs and integration of these AAA navigators with the COCs and the HMIS system, so that we're not working separately but together. So thank you so much for the meeting today. It was excellent.
Thank you very much. All right. Up next, we have Elizabeth Stone. Please introduce yourself, and you have 3 minutes.
Hi, good afternoon. My name is Elizabeth Stone. I'm currently residing in low-income tax credit senior housing in Morgan Hill. I was so glad to see that very first slide highlighting that gap of accelerated aging at age 50 and the number of people that are becoming unhoused and unable to access services, and that are also the largest group of people that are dying unhoused, besides younger people that are dying of substance overdoses. I'm decided to speak because I'd like to share just very briefly my own personal experience. I've been very involved in policy and written some grants and lived experience perspective. However, on May 9th of last year, 2025, I had a cancer diagnosis, and 3 weeks later had a new heart condition diagnosed, which led to me believing the most responsible thing was to give up housing that was not necessarily safe and was too expensive to afford. This led to my living in a variety of hotel rooms, which also exposed me to a number of people that are kind of stuck there. And although I've worked as a case manager and worked in behavioral health systems for 20 plus years, it was extremely difficult. No matter how much research I did in getting services at Stanford Hospital, to actually find services that would help me. The minute there was any indication I was somewhat self-reliant, I was immediately ineligible for things. And because of this kind of continued cycle, the hole that I've dug myself in, trying to just keep hanging on by fingertips, is still really, really difficult to get out of. I guess my good news is 2 months ago, I had a heart procedure, and today I learned that it's been effective. I also had to forego any chemotherapy or any post-surgical cancer treatment because I knew the only way to get back into housing was to work. And luckily, I have a master's degree and I've taught a long time. So I was able to teach one course at a community college, which gave me the income to get into housing. So there's a number of us with really deep lived experience and are really sad things that didn't need to happen that also have some policy expertise. So I really hope there's continued opportunities for us to be deeply from the initiative involved in solutions and options. Thanks so much.
Thank you very much for sharing. All right. Our current last hand, Brandy, you have 3 minutes. Please introduce yourself. Brandy, are you able to hear us? It says you're unmuted, but there's no sound coming through on the microphone icon.
Can you hear me now?
Oh, yes, we can hear you now.
Oh, I did, just for anyone else who ever has that problem, I did the mute my audio and then unmute, and somehow it worked.
Perfect. We love that.
Great. This is Brandy. I connect with those who are unhoused and other service providers in Fresno as an advocate, community advocate. A lot to say, so I'll talk first, but thank you so much for this. older populations, another thing that might be considered is assistance with vehicle registration and funding for safe places for people to park. We have those who are older who lose their housing and then they just have the RV or vehicles to live in, and then those are towed by, unfortunately, sometimes our homeless assistance people in our town, and then they are unsheltered completely. We have issues regarding medical emergencies that may be something to consider. Like I talked to a person who his wife and him lost his house because of his wife's medical expenses. She was in assisted living at the time, but they lost their housing. Another man shared with me about how he was in the hospital for extended period of time and lost his rental. Protections for people who are in shelters, because I've heard from people who were exited out of shelters because they said that their medical needs surpassed what they wanted to be able to protect, including being in the hospital even if they did not need assistance, being exited, as well as sometimes the person who is taking care of them being exited. And when people get exit out of a shelter, there is no recourse for them because we do not have grievance systems for anyone but one shelter provider. But for those who do get, once you're exited, you'd have no protection. I appreciate and support shallow rent subsidies, and okay, make sure I have enough time for things. One thing that would be important is some sort of more accessibility for more people than me to have a voice in our community to share with you guys. So I wanted to suggest some sort of means for ongoing, being able to share ideas, struggles, local issues, maybe with clear idea of what they should be sharing in these things, like either through message lines or online portal, or even handouts that we can connect with service providers to share ideas that they have and concerns. We have issues just like other communities where our local homeless assistance is not protecting people's dignity, rights, and possessions, as well as shelters, and have a means for them to be able to speak into those and communicate with your amazing commission. And also help with access to disability rights, as we have people like when there's displacements, encampment resolution, a means to connect to ensure that their disability rights are protected. And I do appreciate the idea of having a card with rights, but also stronger means, other ideas for stronger means of protections. Thank you. I have a whole lot more to say, and I'm so grateful for you guys, but definitely appreciate that, as well as recognizing accelerated aging for our issues, and also just protections for issues with rentals, because we have, I met a man who, because he's older, he was staying in a low income rental, and then the house was sold, and he didn't realize he couldn't afford the rent after staying there for 20 years. So thank you so much.
Thank you. Yes, and if you want to continue any of your comment, you may email us at calich@calich.ca.gov. I know it's a bit repetitive. Great. Thank you all. I see no other hands raised in the public audience. Javon, would you like to make another comment?
No comment.
Okay, perfect. I just wanted to make sure I didn't miss anything from you. All right, great. I will pass over to Megan to close us out.
Great. Thank you, everybody. Thank you to our committee members for your insights and comments during today's meeting. Really appreciate the thought partnership that exists and the expertise and commitment that exists on this body. Appreciate members of the public for joining us and for providing your lived experience and your commitment to this work as well. Our next advisory committee meeting is on November 4th, 2026 at 2 p.m. And we hope that you all can join in, listen in on our next executive council meeting on September 2nd, 2026 at 1 p.m. Just a reminder that meeting can be attended in person as well as virtual. But with that, this meeting is adjourned at 4:14 p.m. To receive up-to-date information on the Executive Council's activities, please sign up to receive our email Follow us on social media, X, Facebook, and LinkedIn. Thank you all so much. Have a great day, folks.